Single. Alright, so talking about the next section of the hospital we should be looking at, this is what is known as the ICU. So ICU is what is known as the intensive care unit. Intensive care unit. Now, if you look at an ICU, everything in an ICU is looking sophisticated. Why? Because the care given in ICU is basically for patients that are critically ill. Alright, so what we got for this ICU, we said that it's a specialized hospital ward. So this hospital ward is designed for patients with life-threatening conditions. So this condition require constant monitoring and advanced medical support. So in ICU, the treatment they are giving you is very personal. It's personalized. Do you understand? You can even have one nurse looking after just two patients. Do you understand? So what happens in an ICU? There's 24/7 monitoring. All right, nurses are doing night and day duties. It's switching so fast, So they are checking for vital signs like the heart rate, the blood pressure, oxygen levels. Do you understand? Continuously. Advanced equipment. You have ventilators. You have dialysis machines. You have infusion pumps. All of this is to help any organ that is failing in function. So specialized staffs. All the staffs there are basically trained to give this critical, care. All right. So nurses, respiratory therapists, other specialists, all of them, they work as a team. So what are the reasons or what could make a hospital admit a patient into the ICU? All right. So if the patient has severe trauma or surgery, so they are recovering, stroke, heart attack, organ failure, sepsis or any serious infection, respiratory distress, and all of that. All right. So these are the different types of ICUs. We have just the medical ones, the surgical ones, maybe after operation they take you there. Cardiac ones, that one is heart related issues. Neonatal one, that one is to take care of babies that maybe they gave birth to you premature or with some congenital issues. Pediatric one, that one is for children that are critically ill. All right. So what to expect in an ICU is it's not every time family relatives are allowed in. So visiting hours are within a strict time. There's strict hygiene. Sometimes when you want to go into an ICU, you have to take out your shoe, wear their shoe before you go in. All right. So one nurse per patient or one nurse per two patients, depending on the severity of their conditions. All right. The emotional support services for families.